Hi everyone, I'm Vicky, Seacroft PCN Manager. I'm pleased to welcome you to our Seacroft Primary Care Network podcast. It's a chance for you to meet the people involved in your care and to have an insight into how practices work together to create the network. Today we are meeting our Primary Care Network Proactive Care team. Please can you introduce yourselves and provide a brief overview of your role within the PCN Proactive team.
Hi everybody, my name is John Lynch. I'm a community matron. I've worked in the Seacroft Proactive Care team on Common for the last 6 months. Next year will be my 40th year working in the health service. I'm incredibly proud of the health service. I have been very lucky to join this team a number of months ago. My remit as a community matron is to work with older people within the locality of Seacroft to provide a holistic service for their needs. Thanks.
I'm the healthcare assistant working with the Proactive Care team.
Hi, my name's Becky. I'm a social prescribing link worker.
Hi, I'm Joanna. I am a social prescribing link worker with the Proactive Care team.
Hi, I'm Katie. I'm a social prescribing link worker and we coordinate older people's care within the community.
Joanna, please can you provide a description of the Proactive Care team's role within Seacroft PCN?
Yes. We are a team that is completely unique to Leeds. We would predominantly look after adults of the age of 65 or over that are at risk of frailty or becoming frailer within their own homes. We would have a conversation based on what's important to them and what matters to them. We'd look at what they're already doing well and what's keeping them well, and we would then work from there to make things better or to help improve things or to maintain things to avoid hospital admission or falls or prevent somebody going into crisis. We are a team that looks at proactive care planning, and that would be anything from building the support network around you, the scaffolding that supports you, and looking at proactively planning right through to the end of your life. So we would look at giving you the control to allow you to look after yourself properly. We cover 4 practices within Seacroft. So we would look after Oakwood Lane, Park Edge Practice, Windmill and Boundary Lane. And we would look after all their adults over 65. But we would visit at home.
How did the Proactive team come together and what motivated its formation?
So we came together about 5 years ago to look at a group of older adults in the Seacroft area living with a specific set of long-term health conditions. The idea was to test the role of a care coordinator to identify if there was a need for such a role in the community. We identified that there was a need for this service, and the foundations have always been based on person-centred care. And as you can see, we're all still here and the team's growing 5 years down the line. So, the rest is history, really.
Debbie, what are the unique challenges that the population of Seacroft face?
Seacroft is a special place to me. I was born here and I have worked and lived here for most of my life. The people of Seacroft face a number of challenges: poor or little housing opportunities, deprivation, ageing and multi-generational population and health inequalities. Within Seacroft there are strong family bonds, and often people who were born here tend to stay here.
Ron, could you share an example of where your team positively impacted a patient's life, please?
Yeah, absolutely. So we like to think we positively impact everybody that we see. Our team provides out-of-hospital care, but care that is linked with your GP practice. From my perspective, I've been a community matron for nearly 20 years and worked with older people. And sometimes care can be either medicalized or it can be driven by professionals. What I can say about our team, and what's unique to our team, is that we provide patient or person-centered care that really revolves much more around the wishes of older adults within Seacroft. Within West Yorkshire, there's a framework called a respect framework, which is something we utilise, and that's really around. It is kind of what it says on the tin. We respect what people's wishes are. So, from a professional perspective, we all go in on the basis that we provide services for older people based upon their wishes, and that includes their wishes for now, their wishes around their families, their wishes around their future care, their wishes around how and where they would like to die. And we also maybe talk a little bit about, in that sense, we do a lot of advanced care planning. So the basis of what we do, it does have an evidence base behind it. It's based, from my perspective as a community matron, it's based upon the principles of comprehensive geriatric assessment and evidence-based practice. But in some ways, what we try to provide is what I would call evidence-based care. So we link theory with what it is older people are trying to achieve. Everybody is very much an individual, and what I think we would all say is, for every individual that we go and see, we try and provide an individualized service around what it is they would like to achieve within their lives, and maybe also an individualized service around some of the challenges that people within Seacroft can face, something that Debbie so eloquently stated there recently. Seacroft has its challenges, but it's also a fantastic place to work. There are fantastic people in Seacroft, and I think we see that on a daily basis. We have the privilege of going to see older people and their families and their pets on a daily basis. So what I'd probably say in answer to your question is, we like to make a positive impact for everybody we go and see, and that's probably what I'd say.
Thank you, John. Joanna, can you share examples of how you collaborate with other organisations to support the care of your patients?
We started 5 years ago, and between then and now, all of us as a team have built some really strong relationships and done lots of co-produced working with third sector organisations. So, for example, in Seacroft, it would be the LS14 Trust, it would be Gipton Action for Elderly, it would be the Gipton Fire Station, as well as bigger, wider charities such as Age UK, the Green Doctor, Care and Repair. And then coming together at a more local level with our local care partnerships and public health to provide that more person-centred, co-produced, very area-specific work.
If anyone feels that support from the proactive care team would help them, how would they get in touch?
So if you think that we might be able to provide support for you or a family member, just ask your GP to send us a message. If you're a professional, you can reach out to us by emailing seacroftpcn.referrals@nhs.net. Just give us a shout and we're here to help.
So thank you to everyone for attending this podcast, and I look forward to joining us next time.